So I'm going to go ahead and call the meeting to order. Shall we have a pledge of allegiance? I pledge allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Let's see. Tracy Cassidy, I guess Commissioner Cassidy, not here. Well, I will say a couple of things as it relates to the trustee report in her absence. Actually, Eric and I went to that meeting, and I'll say a couple of words and then I'll let Eric say what he'd like to. It was a superb meeting. Kudos to the people who organized it. Was well, lots of information. There were heartfelt discussions regarding what in the world are the trustees doing, the bylaws of the trustees. There were some meaningful conversations. I have to say I've not been all that impressed with that group, but their current leadership has stepped up, and it was an altogether good meeting. Now, the bylaws changes are only proposed. We could go through them, but until they become definitive, and it's really out of our hands whether they become definitive, there's no sense in hashing over that. Do you have any comments to make?
Mr. Chairman, I believe that adequately summarizes the meeting.
Yeah. Okay. Fiscal update. You're front and center. Thank you.
Thank you, Mr. Chairman. Financial combined, please. So what I'd like to do today, I realize we have a full schedule, so I will be quick about this. I'd like to review how we ended fiscal year 24, high level, and then take a look at where we are for fiscal year 25 as of the end of October. So this is stale data right now. This is the cash position. We ended with $6,148,000 in cash at the end of fiscal year 24. After we deduct board committed funds, program restricted funds, that left us with 3.43 months in reserves. Now that information has changed since we're now at the end of October. But what I do want to share with you more importantly is how we ended with revenues and expenditures. So in revenues, we were over budget by $30,362. In prior months, through our discussions in fiscal year 24, environmental had been under budget, but they closed the gap. They were only under budget by $7,400, which is, a very small amount when we're looking at a budget of $1.8 million. Health service fees under budget by $223,000. And again, I'm going to bypass these items here. Again, overall, we were over budget by $30,362. We were under budget in personnel expenditures by $1.2 million. As we had discussed through fiscal year 24, we had a number of open positions. We had trouble recruiting people, retaining people, and we're seeing this in our under budget amount here. The budget amount for fiscal year 24, we had budgeted for 113 FTEs, and we ended at 95 FTEs, actual FTEs, for the end of fiscal year 24. We were under budget in operating expenses by $540,000. We were over budget by $85,000 in capital expenditures. The reason that we were over budget in capital expenditures is we had learned that our server had basically ended its lifespan. And we had the opportunity through the infrastructure grant to replace that server and have it paid by a grant. So we elected to do that sooner rather than later while we had the funding available to us. So that's what leads to that 85,000 over budget in capital expenditures. Trustee benefits, we were under budget by $46,000, leading us to an excess of budget over actual of 1.8 million. And once we adjust for the change in our accounts receivable, a decrease in accounts receivable, 240,000, adjust for accounts payable, factor in our beginning cash balance, that brings us back to our ending cash of 6.1 million. Before I move to fiscal year 25, do you have any questions on 24? No.
Are you happy?
Yes, I will be happier once we are past some of the Luma struggles. And you'll see when we look at the cash reports where we've made advances in fiscal year 25 that I'm happy about. But we do still have some struggles.
Okay.
But I'm happier than I was. Moving on to fiscal year 25. So at the end of October, we ended with $7 million compared to our June ending balance of 6.1 million. We have 3.7 million in restricted funds and board committed funds. I did break out the opioid settlement funds so we could see what that balance is. As of the end of October, we currently have 2.4 million in opioid settlement funds. Other restricted funds, we have $522,000. And in board committed funds, we have the 746,700. So that leaves us with, 3.59 months in reserves. And next month, we'll talk about moving some of those funds into board committed funds. I had hoped to do that this period, but it's been deferred to next month. We have adequate funds to do that now. I'm happy about this because what we've been able to do is Jennifer on our fiscal staff has done an excellent job in working with DHW and our other agencies such as DEQ, but primarily Department of Health and Welfare, in collecting a lot of our old accounts receivable. So you can see here at the end of October, our accounts receivable decreased by $524,000. And that's a result of things that have been on hold, waiting to be processed by other agencies because of the Luma conversion. So I'm happy to say that as of the end of October, barring any other glitches, system glitches, we are now within 30 to 60 days on our accounts receivable. That's great progress considering what we've gone through since the Luma conversion. So that's an advancement. If we look at starting at the beginning of our year-to-date budget to actual for fiscal year 25, ending October 31st, you can see that we are over budget in revenues by $1,191,000. And most of that is residing in grants and contracts. Now, keep in mind, we're only 4 months into the new fiscal year. What we've received and what is in this 700,000 is we have received 532,000 in opioid funding in the first 4 months of the new year. And also at the beginning of a fiscal year, we will receive appropriation money or money that has been appropriated to the health districts that funnels through Department of Health and Welfare, where it's paid as a lump sum. As an example, that would be Millennium funding for our tobacco cessation type programs and also for our home visiting program. So as we go through the year and our year-to-date budget increments up, because the year-to-date budget column only represents 1/12 of the budget times the number of months that were in the current fiscal year. It's not an equal comparison. So you should see that gap narrow. So once again, we're over budget by $701,000 in grants. Currently, we are over budget in county appropriation by $416,000. That's also a timing difference. There's 2 quarters of billings in there. So again, over budget by $1.1 million in revenues. Total personnel and expenditures, we're currently under budget by $232,000. Operating expense, under budget by $170,000. Capital expenditures, under budget by $63,000. Over budget in trustee benefits. Keep in mind, those are payments that we are passing through to other partners, such as, say, the opioid funding settlement, where they have applied for funds. We granted them. We approved their application submission for use of funds, and now we're paying them because they have completed their projects. So this could be a timing difference. This one is difficult, as I've mentioned before, to budget for. So over budget by $19,000. Total expenditures under budget by $446,000, leaving an excess of $1,600,000. Once we make our adjustments for our receivables, payables, take into our account our beginning cash balance, that brings us back to our ending cash of $7,028,000. Are there any questions?
How big a party can we have with that much money?
That's not much money.
Okay, so it's not going to be a big party.
No, we're kind of stingy
Well,
with
at
our money.
least it's that much that we're oxygenating rather than being underwater.
It's good to be in this position right now.
Yeah.
And I hope that we can continue regular receipts on our accounts receivable. It's been quite the challenge with the conversion. Now, before I close, I do have one positive note to share. It's not finalized. We should be receiving final word, but I have heard from the auditors that our fiscal year 23 audit is ready to be finalized. It will be a clean audit, meaning there's an unmodified opinion. So that's good for fiscal year 23. In full disclosure, I don't feel good about fiscal year 24 and potentially 25 because of the conversion. So let's celebrate fiscal year 23. If there are no questions.
Thank you. Any questions?
No.
Okay,
Okay,
shall
thank
we
you.
move on?
Thank you.
Subcommittee reports. So there have been 2 subcommittees. One having to do with securing legal services, and the other having to do with development of job description for medical director. As for the legal counsel, the subcommittee met a couple of times, interviewed a couple of different legal firms, and the conclusion was to go with Lake City law firm. They are nearby, they're flushed out with different subspecialties. They presented themselves quite professionally, and Commissioner Duncan recommended them. So for those reasons, the subcommittee agreed to go with that law firm. Eric, by the way, if I may speak for him, was in agreement as well. I mean, he interviewed all of these folks. And so given that a subcommittee is actually the report of a subcommittee is already a motion. I just recently learned that, so I don't even have to look for a motion, but I will have to look for a second to the motion that we hire Lake City Law Firm.
I'm happy to second.
Okay? Glenn, you can hear me? Jessica, you hear me? Well, Glenn, you were on the subcommittee, so you don't have a choice to renege now.
No, I agree.
Okay, anyone on the board in objection to moving forward hiring Lake City Law Firm? Hearing none, the motion passes. Let's move to the second subcommittee report. Has everyone had a chance to look at the actual language that the subcommittee generated? Here again, because it is the wish of a subcommittee, it's already a motion. And so I'm looking for a second to accept the language for the medical director. You're not going to second it?
I can go ahead and second that one too, for sure.
Well, given that everyone who is on the subcommittee is currently attending this meeting, then per force, but if there's any subcommittee member who has changed their mind in the last 24 hours, speak now, otherwise the motion will pass. Okay, motion passes. One other item, as I would like to pursue with the medical director issue, and that is, do we want to, currently, the medical director works with the health district via a memorandum of understanding, an MOU. I believe, and others believe, but I'm going to actually look for a motion here and a passage, that we should actually take the language that has been developed and embed that language into our bylaws. It gives it a little bit deeper meaning. I rehearsed this concept with Commissioner Duncan, and she supports the idea of making it a bylaws change. And so what I'm looking for then is I'll make I don't know, the motion would be that we take the language as we've now adopted it, we've accepted it, and make that a bylaws, embed that language into the bylaws, but we won't do that today because that's going to require pre-notice of some amount of time before you can actually make a bylaws change. So I'm looking for a motion to move forward to make this a bylaws change.
I'm willing to make the motion.
Okay, can I hear a second?
Mr. Chairman, I would second the motion.
Okay. Anyone who is in disagreement with the motion as it has been made and seconded, please speak. Okay, hearing none, then we're going to move forward with the anticipation that at the December board meeting, we will then vote on the adoption of the bylaws change, and Eric and I will work through what that looks like. I mean, to be quite honest with you, I don't know what that would look like, but we're going to figure it out. I believe we are done with the two subcommittee reports. Or any questions about those subcommittee issues from staff? Anyone? Have all of you had a chance to read the language? I mean, I like it. Obviously, I'm biased, but are you happy?
I don't have any objections.
Okay, so let's move on to the consent agenda. So I've actually looked at the consent agenda carefully. Is there anyone who wants, the way I'm going to proceed with this is anyone who wants to extract an item from the consent agenda, do so now. Otherwise, what we're going to do is pass on the whole thing, except for those elements that we have extracted.
Yeah, Mr. Chairman, this is Glenn Bailey. I'd make a motion, we go ahead and accept the consent agenda as here published.
Okay, well, I accept that, except there's two I want to extract.
Okay,
So I'll take your motion minus the two extractions. I want to extract grant HC 6570, which is family planning, and I want to extract the St. Mary's Joint School District. Otherwise, I'm in agreement. The rest of the consent agenda, we can vote on it. Is that okay with you, Glenn?
I concur.
Okay, do we have a second on that?
Wait, I'll second that, sure.
Okay, is there anyone who objects to accepting the remaining consent agenda? Hearing none, the consent agenda is accepted, save for the two items that I've extracted. So let's talk about grant HC 6570. Eric, can you summarize for us what those family planning services are?
Yes, thank you, Mr. Chairman. That contract is in the amount of $94,053. The purpose of that is to provide comprehensive family planning program to assist with individuals planning and spacing births, contributing to positive birth outcomes, improve health for women and infants. I guess to summarize what that means is that this is an income-based program focused at folks that either are on Medicaid or lack the resources to pay for these services. It includes this money funds annual medical exams, education, prescription, or implantation of various contraceptives, counseling of reproductive options, including abstinence. Additional aspects of the funding go to testing, treating, and counseling clients for STDs, as well as tracking and working with the EPI team to track STD. There's also a component of assessing clients' reproductive health plans and assisting them with options as far as what works best for them. As far as that, what we see here at the Health District is in fiscal year 24. We saw around that program assisted with 1,700 visits of individuals in the 5 northern counties.
What's that 1,700 visits out of how many total visits in a given year for all services?
I think it was almost 9,000, Mr. Chairman.
Oh, okay, so,
Revenue-wise, the family planning portion of the clinic makes up about 35% of our overall visits in the clinics every year.
oh, that's interesting.
Mhm.
Okay. All right. Well, I wanted to extract it, not really to shoot it down, but actually learn what in the world are we doing. So please don't take my gesture as hostile. Do you have any questions?
Well, I mean, it's interesting you did that because I didn't see anything in writing about what it was all about. I may be missing it in the report, but it wasn't there. So that's why, it's nice to have information about it if we're going to pass something.
And Mr. Chairman, if I may, I've had that conversation with Jessica, and now that all of our board members can receive information via email, we can include copies of those contracts, in advance of the meeting so that you can review them, so that if you would like to discuss them in greater depth, we'll have that option during the meeting.
That would be great going forward, absolutely, because I'm just hesitant to vote on something that I don't have any knowledge of, and I'm so glad that he brought that out.
Yep, and so certainly expect that in future board packets.
Great, perfect.
Any other comments regarding family planning services?
I'd say yeah.
Are you happy, Glenn?
Yeah, my comment is that from what I've heard, this is a valuable service to our counties. So that's my comment.
Okay, then let's look for a motion to pass that grant.
Yeah, sure, I can make a motion.
Do we have a second?
I would second the motion.
All right. Again, let's vote in the negative. Anyone objecting to this grant, please speak. Hearing no objections, the grant passes. Now let's move on to the last item, the St. Mary's Joint School District. Eric, could you tell us what that means?
Yes, Mr. Chairman, that is a contract in the amount of $14,402 with the St. Mary's Joint School District. What that entails is the Panhandle Health District providing school nursing services to that school district. Primary services will include vision screening, hearing screening, scoliosis screening, immunization records, audits, flu clinics, hygiene presentations, growth and development presentations, as well as assistance with school personnel in individuals that have other health challenges, diabetes, and so forth, and helping act as a consultant between the school district and parents to help those children thrive.
Thank you. Does Panhandle Health provide these school nursing services for other school districts?
Yes, Mr. Chairman, we currently provide these services for 3 school districts. We do have contracts with Kootenai School in Harrison, their elementary school, as well as their junior, senior high, and then the Calder School District as well. And actually, interestingly, I've had calls from 2 other school districts probably within the last 2 or 3 months with people that have open, vacant school nurse positions that they're having a really challenging time filling those positions and kind of looking for guidance or any assistance from the health district that we could offer. So I do feel that there's a potential there that other school districts may also potentially benefit from that in the future.
I mean, that was my next question. For those school districts that aren't, then they are doing it through their nurses?
Correct. So Kootenai School District, Coeur d'Alene School District, for example, all of the schools within Coeur d'Alene School District currently employs, their own school nurses. So they're currently fulfilling that. But for some of these school districts that are having remote areas that are having a really hard time filling those positions, that's where they kind of look to us to do some of those just routine screenings and some of the things that their school nurse would typically be doing.
Sure.
Well, since we have $7 million to have a big party, are we in a position whereby we could actually provide more nursing support for other school districts? Is this in other words, my question is this an arena where we could actually expand our?
Mr. Chairman, I
efforts?
believe it is. And I would say that just strictly my opinion, based on getting 2 phone calls from 2 additional school districts throughout the Panhandle over the last couple of months. I think that there is certainly a need and school districts looking for options on how they can fulfill the needs of their school, but with very limited staffing or resources to pull from. So I do believe that that's an area that we could potentially look to expand.
Yeah,
Well,
I mean, the reason that may be very helpful is that those school districts become very dependent upon that one particular person, and we're not sure, their background, their educational expertise, and we might be able to positivly influence.
It's true.
We'll have more resources. So
Yeah, I very much like what you're saying there, Duke. And if I may add to what you've said, I'm optimistic about MAHA. I mean, let's look forward to a renaissance in, shall we say, making America healthy again. And as you know, we're going to have or you may not know, I want everyone to know it now, the Panhandle Health District is going to sponsor a strategic planning meeting in May. And I hope that one of the proposals on the table in that meeting will be to move forward with measures, public health measures that improve our diet, improve the way we live our lives. In other words, we have to start intervening in the way people conduct themselves if we're going to be healthier. And it seems to me that the kids are a point of contact, a very important point of contact. So inasmuch as we can have a presence in the school districts with one of our agents under the tutelage of Dr. Johnson here, that we can positively impact in the lives of these kids. I think their moods will be better if they eat better. I mean, you see, I mean, this is Robert Kennedy's whole point. And he's not the first one, by the way. There have been a lot of people that have been saying this for years. It's just that now there is a moment in the zeitgeist of the American culture that we're focusing on it. And all I'm saying is, as a health district, let's capture that zeitgeist. You follow what I'm saying?
Mhm.
Well,
So,
what's interesting is that, with my grandchildren, I, have a tendency to watch kids shows, and and kids shows are loaded with garbage food advertisements.
Yeah.
I mean, so then how many parents have I talked to now in, my medical practice who say, well, I try to get them to eat this, but they demand this and they want this junk food. And it's like, well, they've been programmed to eat that junk food,
Right.
So if somehow at the school level, we can say, no, this is why that junk food's not good. And you might want to try this healthy stuff. I mean, it would give parents more leverage, hopefully, so that's that. I think there is a momentum maybe going in that direction, and that would be good.
something that Callie Means, Casey and Callie Means, that brother-sister combo that have made a big splash recently. Does anyone know what I'm talking about?
Mhm.
Good Energy is the name of their book. Well, they're
They're
smart.
both
They're
physicians.
smart people.
Are they both physicians or PhD?
No. He's I don't know. I think his degree is in economics or something. She's a physician, but they both kind of become MAHA adherents, if you will. Something that I learned from her book, the school breakfast program, just their breakfast program, serves more meals than all fast food restaurants combined in America. The average sugar content of that breakfast is 41 grams. The USDA maximum recommended for an entire day is 12 grams. It's a lot of Fruit Loops, folks. So,
And probably have a hard time sitting still all day.
all I'm saying is, I would encourage the Panhandle Health District to move forward, integrating our personnel into the schools as much as possible, because this is our point of contact where we can begin to have an impact on the kids. That you see where I'm going? And we have $7 million, thank you, to spend for a big party.
But what's really interesting is that maybe instead of programs, and I don't know if you guys are involved in that, but in the meal planning of the schools, that may be a real powerful impact. I mean, are you guys already involved with that, or?
No, there's usually nutrition services directly at the schools, but we have been asked to be involved in Head Starts and some of the childcare centers and helping with their menus.
Okay.
And reviewing the nutrition standards there. So we do have a couple contracts that help us do that. We have our registered dietitians on staff that do that and review those and do it in accordance with all the guidelines and so forth. So
I mean, in light of that statistic, it's kind of the school districts are probably focusing on what is inexpensive rather than what is nutritious. And that's, I understand it, if there's poverty, et cetera, but there's got to be alternatives to sugar in the United States that maybe isn't necessarily horrendously expensive. That's why some kind of input like that would be awesome if somehow we can. I apologize. Oh, it's a scammer. Okay, so I didn't know it was coming.
well, and of course we have our Women's, Infants, and Children program here as well too, which addresses nutrition related issues and nutrition education for all of those that come in to take those services.
Great, awesome.
All right.
Mr. Chairman, I just maybe a couple of comments, and I certainly welcome Jenna's input on that. But I one thing to consider, and I certainly welcome the opportunity to be involved in the school, the health district to be involved in the schools, because again, the further upstream that we can be on these issues, the better. But I do wonder to a degree if some of the challenges for these smaller school districts is the competition for qualified nursing staff or medical staff, because we're experiencing that in-house. There's a lot of demand for that level of staffing. I mean, 14,000 is a fairly small amount of money for qualified nursing staffing. So I do think, as Kim has mentioned, we probably have opportunities beyond. Hopefully we have some opportunities with the school nursing program, but also hopefully we'll, through the nutritional services, we'll also have some opportunities in the future.
Mhm.
Well, that just means we have to have some clever accounting.
Well, one possibility then is that if we could have and somehow arrange some form of consultation service where you don't have to be there and serve the meals every week forever. It's like, let's come in, let's give our recommendation for the nutritional services, and we'll recheck you in 6 months and see how things are going or something. I mean, if there's that possibility, we could have a strong positive influence without costing a lot of money, you know, potentially. I mean, there's just ideas I'm throwing out. I realize I have no idea what, you know, the minuscule details are, but, you know.
Well, but it's interesting with the changing political climate as well.
Mhm.
Where are they going to appropriate funds in the future? If that's an area that they're looking at is improving health across,
Mhm.
you know, there may be some grant funding opportunities and things that come across in the
Absolutely.
next couple of years for
Right.
that. So
Right.
Yeah. And we need to be alert to that. I think your point is strong. Yeah.
Mhm. I've heard that the budget there at Health and Human Services is bigger than the military budget. It is gigantic.
Hmm.
So I imagine they'd find some places to cut back probably and redirect it.
yeah.
Anticipating that.
Okay, I'm looking for a motion to accept this grant.
Yeah, I'll make a
second?
motion.
Chairman, I would second the motion.
Thank you, Glenn. Do I hear anyone objecting to the passage of this motion? Hearing none, it is accepted. All right, folks, the consent agenda is dealt with. Eric, you're front and center.
Thank you, Mr. Chairman. I just have one item today, and just to notify the board that we do have our first town hall meeting in Boundary County tomorrow from 6 to 8 p.m. We have advertised that, on our website and to the best of our abilities to date. We are looking at some other options for future town hall meetings, but Dr. Fletcher and I will be in Boundary County tomorrow evening. So attend if you're available, or tell others if.
Yeah, the entire board, and for that matter, staff, you guys are welcome to join us. Now, Bonners Ferry is a long ways to go, but when we have the town hall meetings here, or when we have them in Sandpoint, and I think in a couple of weeks, we'll be holding a town hall in Sandpoint. And as a matter of fact, I might as well, can I encroach on your time? The director let me encroach on his time. I'm sensitive to your point, sir. I think it's strong. I've had the exact same reflections you've had. I step out my front door and I go, my goodness, what is going on in the sky? And then the whole atmosphere takes on that foggy appearance. That wasn't that way 10 years ago. I don't remember that. This is something qualitatively different. Now, you're very kind to say that we're a powerful institution. We're actually a non-governmental organization, an NGO, and the harsh reality is we have next to no real authority at all. That being said, we will in fact be holding town hall meetings. We will in fact be harvesting thoughts from the public. Your expressed thought will go on our roster of items to pursue. I think I've already mentioned it once. I'm going to repeat. In May 10th of 2025, Panhandle Health is hosting a strategic planning meeting, and all of the elected folks in the region will be at that meeting. And so that will be an opportunity to bring forth at the highest level of, shall we say, amplification, In other words, you can have your voice heard as much as we can project it at that moment in time. And we can fill you in on more details later. You don't have to be taking notes and going, gee, I've missed my one opportunity. Again, let me repeat, there's nothing we can do per se, except maybe help you make the issue apparent to more people. And maybe some of those people may even reach the ear of the governor, and maybe the ear of the governor would be enough to say, you know what, federal government, we don't want your planes flying over our state anymore. Maybe. I don't know. Who knows?
I appreciate it. I think there is some precedent for that. There's a state.
Tennessee, right.
Tennessee is the main precedent. What I can't help but believe is if this board were to conclude, whether just as a group of individuals or as a board, that there is something that is a health hazard connected to that, then you know, do your own research. But if you were to conclude that and say it is the opinion of the board that there is a health hazard looming, that could control. You could simply advise the mayor of Sandpoint, you might make a phone call to the mayor of Bonners Ferry. It is when it becomes like electric, meaning one person is telling another person, this has gone on too far, and we find there's concern. I'm at home. I know the mayor. I've met him. I know some people. It doesn't matter what I think is going on. But when the Panhandle Health District, as a board committee, says there's something fishy going on here, we want to acknowledge that we believe we could potentially have health hazards. A simple letter like that to a mayor of any town could absolutely lead straight to Boise. I think that on a state level, the state of Idaho has to say there's enough townships in this state that are highly concerned and don't consider this just a far-fetched theory, but there are some very intelligent people that think that something is really afoot. That's all, you know, I appreciate you giving me a ton of your time, and I can tell you're giving me your honest attention, and I genuinely appreciate it. Never thought I'd even see myself in these shoes. But you say that you guys aren't a governmental board, and you're not, and I understand that, but you are a highly, highly esteemed board, and that's what brings me here, and that's what brings you guys up in conversation quite a bit, you know.
I'll make the following deal. There's nothing I can do today at this moment, but I will construct a letter echoing your sentiments, and I will bring that letter to the board on our December meeting and ask for approval or disapproval of that letter that we will send out to appropriate elected officials. Again, we have no authority, but some elected officials begin to have a little bit. And I like your sentiment that if you're going to try to affect change, it starts at the grassroots level and see what happens, get it to grow. I certainly echo your concern. I mean, well, I don't echo it. I share your concern, and I'm willing to propel it. So that I'll do that much. We'll construct a letter. I'll bring it back to this board. I can't send the letter alone. It has to be with the blessings of the whole board. You appreciate that. So I will bring it. We'll have a board motion. It'll be an action item, and then we'll just send it to a bunch of people.
That sounds.
And that's
music to my ears. That's incredible.
and so we'll help you as best we can. All right, Mr. Director.
Yes, sir.
I'm sorry I encroached on your time.
I was through.
Okay. Well, we've heard from public. Any other public comments? Do I hear a motion to adjourn?
I would like to make the motion to adjourn.
Do I hear a second?
I would second the motion.
Absent any objections, the meeting is adjourned. Did we make it under an hour?
Even starting a bit late.
Yeah, okay. Well, thank you, everyone. Sir, thank you for coming.
I appreciate it. Thank you guys for
Yeah. All right, there we go. So.